In fact, this bill that's being proposed is ugly. It's so ugly it has to sneak up on a glass of water just to get a drink. Well, let's take a look specifically at why it is that we're going to have this great health care political drama tomorrow, and yet we're not really passing the believable test. And first of all, let's just take a look at if anything has really changed at all. First of all, this bill imposes $500 billion in Medicare cuts. That's a whole lot of money. $500 billion is going to be taken out of Medicare. The old Democrat bill took $500 billion out of Medicare. The president's new bill takes $500 billion out of Medicare. The Republican alternative takes nothing out of Medicare. Well, nothing seems to have changed here. This bill enacts job-killing tax hikes and government regulations costing hundreds of billions of dollars. The old Democrat bill, yes, that was true for it. The president's new plan that's online likewise enacts a lot of job-killing tax hikes and government regulations that cost billions of dollars, and yet the Republican alternative does not. It spends $1 trillion on government takeover of the healthcare system. This is something that people are really conscious of. This is a government takeover of an entire sector of the U.S. economy. $1 trillion, and I think that number is short because it's not counting the unfunded mandates to states. The old Democrat bill does that. The president's new bill does it. The Republican bill does not. So what's changed here? It benefits trial lawyers by failing to enact legal lawsuit reform. Well, the old Democrat bill did not have any real tort reform in it. In fact, it went the opposite way. The president's new bill is not different. The Republican alternative is the opposite. It protects backroom deals with Washington special interests. We've been told these deals have been taken out, but they've not been taken out. The old bill had those special deals. The new bill does. The Republican bill does not. It puts government bureaucrats in charge of personal health care decisions. This is something a lot of Americans are very concerned with. It's bad enough if some insurance company is getting between you and your doctor, but it's even worse if a government bureaucrat does, because if you don't like the insurance company, you can change companies. You can't change governments. And so, again, the new proposal is no different than the Democrat proposal, and the Republicans are not doing that. It breaks President Obama's pledge not to raise taxes on those who make less than $250,000. Well, certainly, the old Democrat bill certainly did raise taxes on people making less than $250,000. The new proposal still taxes people more who make less than $250,000. The Republican proposal does not. It forces individuals to purchase government-approved health insurance. That's something that people are pretty sensitive to. The government telling you, you must buy health insurance. The old Democrat bill does that. The president's proposal still does it. Republicans reject that idea. And it forces employers to choose government-approved health insurance, or they're going to have to pay a new tax. So the government is going to tell you what kind of insurance you've got to purchase, or you're going to pay a new kind of tax. The old Democrat bill did that. What the president's proposing continues to do it. The Republicans don't. So is this great drama that's supposed to take place tomorrow really something new? I'm not so sure that it is, in that it seems to follow the same pattern.